Good afternoon, Carmen Lester. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I have always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Discuss the personal attributes that make you especially qualified as a nurse.
I am extremely detail-oriented. Whether I'm charting and keeping records, noting patient conditions, or administering medication, I always double-check my work. Efficiency is important, but not at the expense of accuracy, and I believe in removing as many barriers to accurate care as I possibly can. I am also very observant. I tend to notice the details about patients' conditions that others miss. Whether it's a glassy look in their eye or a certain way they are clutching their abdomen, I look for and record details that may offer clues into the causes behind a patient's condition.
How will you make a positive impact on the nursing profession?
There are different ways to contribute to making a positive impact on the nursing profession. Creating feedback forms helps us secure and promote our jobs and gives us the motivation to work hard. Nurses deserve better working standards and benefits for their hard work. Therefore, listen carefully to what nurses have to say to lighten the workload. Additionally, it provides continuing education for all to make us stay updated to be the best always.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
What do you like most about your profession?
What I like most about my profession as a nurse is the opportunity to make a meaningful difference in people's lives every day. Nursing allows me to provide compassionate care and support to patients during some of their most vulnerable moments. The ability to offer comfort, alleviate pain, and promote healing is incredibly rewarding. Additionally, nursing is a dynamic and ever-evolving field that challenges me to continuously learn and grow. I appreciate the collaborative nature of healthcare, working alongside dedicated professionals to deliver the best possible care. The relationships I build with patients and their families are deeply fulfilling, and knowing that I have positively impacted someone's health and well-being is what drives my passion for nursing.
Your preparation time is over. Please start your OET speaking roleplay.
Good morning. My name is Carmen Lester, and I am one of the nurses in this community health center. May I know your name, please?
Good morning, Carmen. My name is Mihiraa.
Hi, Mihiraa. I can see that you're feeling worried. Please take your time and let me know how I can support you today.
Thank you, Nurse Lester. I'm really concerned about my father. He was diagnosed with liver cirrhosis recently, and I know that his drinking has played a big role in it. But he still refuses to stop, and I just don't know what to do anymore. I need advice on how to help him quit before it's too late.
I understand how difficult this must be for you. Watching a loved one struggle with alcohol while dealing with a serious health condition can be overwhelming. Mihiraa, I appreciate you reaching out for support. Before we discuss ways to help your father, I'd like to get a clearer picture of his health. It would be helpful if you could tell me about his current health status in detail.
Yes, actually. He's been more tired than usual, and his skin looks slightly yellow. He also complains about swelling in his legs and stomach. A few days ago, he mentioned feeling nauseous all the time, and his appetite has decreased a lot.
Thank you for sharing that. These symptoms can be signs that his liver condition is progressing. Liver cirrhosis affects how the liver functions, and as the disease advances, it can lead to complications like jaundice, fluid buildup, and loss of appetite. It's important that we address these changes early. Now, regarding his alcohol consumption, I'd like to explain how it impacts liver cirrhosis. Continued drinking worsens liver damage and increases the risk of complications, such as internal bleeding and liver failure. It also significantly reduces life expectancy because the liver loses its ability to heal. Given these risks, quitting alcohol is the most crucial step in managing his condition.
I know that, and I've tried to explain it to him, but he doesn't listen. He says he's been drinking for years, and that stopping now won't change anything.
That sounds frustrating. It's not uncommon for people with long-term alcohol use to feel that way. To understand his situation better, Mihiraa, could you tell me more about his drinking habits?
Sure. He drinks every day, usually in the evenings. I don't know the exact amount, but I'd say it's more than a few drinks. He did try to cut back once when he first started feeling sick, but he gave up after a few days. He says alcohol helps him cope with stress, and I think he feels lonely too. He doesn't have many friends, and he avoids talking about his feelings.
It sounds like your father may be relying on alcohol as a way to cope with his emotions, which can make quitting even more difficult. I know this is a challenging situation, but please know that change is possible. Mihiraa, stopping alcohol is one of the most important steps in slowing the progression of his liver disease. If he's able to quit, he can reduce the risk of further complications and improve his overall well-being. The sooner he takes this step, the better his chances of managing his condition and maintaining a better quality of life. You're doing the right thing by seeking support for him, and I'm here to help you navigate this.
I understand, but how do I get him to stop? He won't listen to me, and I don't want to push him too hard and make things worse.
That's completely understandable, Mihiraa. It's not easy to help someone quit drinking, especially when they may not be ready to take that step. But you're not alone in this, and there are several options that can make a real difference. A medically supervised detox program can help him quit safely, minimizing any withdrawal risks. Counseling, whether individual or group therapy, can provide emotional support and address the underlying reasons behind his drinking. Support groups like Alcoholics Anonymous can also be incredibly helpful, allowing him to connect with others who have faced similar challenges. Encouraging small lifestyle changes, like engaging in new activities or routines, may also help reduce his dependence on alcohol. Most importantly, I strongly recommend involving his doctor to ensure he gets the right medical guidance and support tailored to his needs. Would you like help in exploring these options further?
That all sounds helpful, but I don't know how to convince him to get help. He doesn't like talking about his problems, and he can be very stubborn.
I know this is a difficult situation, Mihiraa, and convincing him won't be easy. But you're not alone in this, and there are ways to encourage him with kindness and patience. Gently reminding him of the seriousness of his condition and how quitting alcohol can improve his health might help him see the importance of making a change. Most importantly, let him know he doesn't have to go through this alone. He has you and his family who care deeply about him. Sometimes, involving other loved ones in the conversation can make him feel supported rather than pressured. You might also consider seeking help from a professional, like his doctor or a counselor, who can explain the medical risks and provide guidance tailored to his needs. Even small steps toward quitting are progress, and every effort he makes is a step in the right direction. How do you feel about these approaches, Mihiraa?
Yes, I think that would be a good start. Maybe if he hears it from a professional, he'll take it more seriously. Thank you, Nurse Lester. I really appreciate your guidance.
You're very welcome, Mihiraa. I know this is a tough situation, but you're doing the right thing by seeking help for your father. I'll help you arrange the appointment, and in the meantime, if you need any further support, don't hesitate to reach out.